Hello, 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 and welcome to another episode of Wellness Wednesday. I am Dr. Latoya Wells, Doctor of Nursing Practice, owner of Wells Legacy Health and Wellness. I'm excited to be here with you tonight. I have a series that we're going to be talking about throughout the month of June, and we're going to be talking about men's health. So, men, let's talk. Again, I'm Dr. Latoya Wells, family nurse practitioner and owner of Wells Legacy Health and Wellness, and I'm so excited to be here with you all tonight. As we know, or if you don't know, June is Men's Health Awareness Month. And last month we talked about mental health and maternal fetal health month and all the things, but we can't discuss health without focusing in on the men, right? Because I have some really important and amazing men in my life, and I want to make sure that they are staying healthy and that they're staying on top of all things, their health and wellness. And it's not just their health, their mental health, it's not just the physical health, it's their psychological health, it's their spiritual health as well. And so we're going to talk about it tonight. There are some things that men don't talk about, or some men don't talk about. And so let's be honest, there are so many men who are out here surviving, right? But they're not healthy. And during the month of May, I had an opportunity to participate in I was on a radio show. I don't know what I was a guest on a radio station show, and we talked about mental health in mental health in men, not just Black men, but in men. And it's so important that the men are taking care of themselves, because in all actuality, we see them every day. I can look across the street and I see my neighbor here and I see my neighbor there. And as I'm walking throughout my neighborhood, I see the men who are my neighbors, who are friends, who are family. And many of them are smiling in public, but they're suffering in silence. They're ignoring the symptoms because they got to go to work. And if they don't go to work and they don't take care of the family, who's going to do that? And they're avoiding the doctor because they don't want to hear the bad news, right? They don't want to hear that their blood pressure is high. They don't want to hear that their cholesterol levels are elevated. They are calling exhaustion. They're exhausted, but they're just saying that they're very tired. I'm just tired, and that's just normal. That's what comes along with the territory, right? Of holding down the family, carrying the weight of the world on your shoulder, and stressed, but really it's depression and chest pain, but calling it heartburn. And so there are too many families that are planning funerals for men that should still be here, right? And so I don't want to scare anyone tonight, but I want to be real. And many times when I'm talking to my male patients, all of my patients, but with my male patients, some of them I have to come at them with a different tactic. And so the ones who, get together and hang out and play basketball and, sit underneath the tree in the park with their friends, or on the lake fishing and doing all of the things, we're forgetting our health, right? And so if you're one of those men, if you can identify with any of the things that I just mentioned earlier, then I need you to tap in. I need you to tune into this. And women, if you are listening and you know that this is something that a man in your life or someone that you know, family, friend, what have you, may benefit from this information, share it with them. Encourage them to go and get their health screenings, encourage them to go in and be seen by their healthcare and primary care provider. And I'm going to put, it's not shameless because it is a plug, that Wells Legacy Health and Wellness, we're offering, we're accepting new patients, and we are accepting some insurances. And I've been getting some outreach from several male patients who don't have insurance, but yet need to be seen. And you know what? We're working with them to get them in, to get them taken care of. And so we want to talk about the things men don't talk about, but that are actually killing them. And so one of the things that I want you guys to know, that what you're going to get out of this talk tonight and out of this live tonight, is that men should understand the importance of preventative screening. Some of the warning signs that we should never ignore, and learning when you should get recommended screenings based on your age, and how to navigate this healthcare journey and wellness journey without feeling unseen and judged. I want you to feel seen and not judged, and to understand the strength in asking for help. and to make sure that you are encouraged, one, to establish care with the healthcare provider before there's a crisis. And one of the things that I've noticed is that there are some individuals, male, female alike, the first time that they're seen by a doctor or establish a relationship with a provider, not just doctor, nurse practitioner, what have you, a healthcare provider, is when they end up in the emergency room and they get admitted. Prior to that, they have no relationship. They haven't gone in to see a provider. And so we need to change that narrative. And so tonight I'm here to help, right? I'm here to help. And the reality of men's health is that some of the statistics are powerful that we need to talk about. 1 in 2 men will develop cancer in their lifetime. Men in the United States die 5 years earlier than women on average. Men are less likely to visit a healthcare provider on a regular basis. And men only seek symptoms. Some men only seek care when symptoms become severe. And heart disease is the leading cause of death in men. When we're talking about Black men, just as if we were to talk about Black women and non-Black, there are some statistics and there's some things that are more, this population of individuals are more prone to. And so they experience higher rate of high blood pressure, strokes, diabetes, prostate cancer. And many of these lead to their untimely death. And so some men will change the oil on their car every 3,000 miles. They'll schedule their hair to go to their barber shop and get their hair cut every 2 weeks. But they haven't checked their blood pressure in 3 years. I'm going to pause and let that sit there. Because men, there's some things that you guys do on a routine basis. And not all men, I just want to preface this, it's not all men, but there is a higher percentage of men that I'm speaking to. And if I'm talking to you tonight, tap in. So what are some of the things that men don't want to talk about when it relates to health? And some men walk around in silence, suffering and dealing with some of these things. And one of this we're going to talk about is the elephant in the room, erectile dysfunction. I don't know if you realize it, but there's certain medical conditions that can cause this, and there's certain medications that could cause this. Some of it is just age. Some of it is, cardiovascular in nature. There's not enough blood flow. There's, plaque in the arteries, things of that nature. But one of the things that I want to talk about is erectile dysfunction. This is not something that men have to suffer in silence. I don't know about you guys, but some of us women, we talk about all things when we're with our girlfriends. And I know it may be cliche, it may not be the norm or acceptable to discuss certain things, but find someone that you are comfortable talking over this with, your partner, your wife, what have you, your healthcare provider. So erectile dysfunction or ED can be linked to heart disease, as I mentioned, diabetes, poor circulation, hormonal imbalance, stress, anxiety, and depression. And we got to take care of ourselves, men. And, I had a patient to come see me, and this individual is, fairly young, and blood pressure wasn't being managed well at all. And so we began to talk about some things, and we really talked about some things. And when I mentioned the impact of this on their intimate and sex life, they sat up tall in the chair on the table. Yeah, I'm talking about that, because we got to make sure that you're healthy, and taking care of your blood pressure is just more than popping a pill. It's exercising, it's taking a look at what you're eating and how you're eating, it's taking a look at all of those things. And those are some of the things that we talk about during those visits. So ED is something that happens, and sometimes it's the warning sign or the trigger that something bigger is happening within the body. And because men shun, or they shy away from talking about this, because I had one patient say, it's supposed to always work. Well, sometimes it doesn't. And if that's the case, we really need to look into it to see what's going on. But there's a myriad of different reasons that could cause this. And so having those conversations up front and early can definitely help. The next thing is depression in men. We just had May, the month of May. We just came out of the month of May. So happy June, everyone. And we talked about mental health in everybody. And there was a segment that I did on a radio station speaking on mental health in men. And one of the things we want to talk about, and one of the things that I talked about, is that it doesn't usually present with sadness. Some will, but others, it shows up in different ways for men. So it may look like anger. It may look like irritability. It may look like they're isolating themselves. They're overworking. They're throwing themselves into their work, drinking, emotional shutdown, lack of motivation. This is what depression balled up into one may look like in men. And so, whereas with some women and some other men, they may show that they're sad and they may cry and they may get emotional and things of that nature. However, we can't use that as the go-to to determine if someone is dealing with depression, because typically men mask their depression in different ways. And so men are significantly less likely to seek mental health treatment. Yet suicidal rates in men remain alarmingly high. Like the suicidal rates in men is higher than women. And one of the things that I want to talk about is that some men were taught to provide, but were never taught how to process. Some men were taught to survive, to provide, but never taught how to process things. And I can say, my husband may be listening, but that's something that we have to work through. And that's where therapy comes in. That's where talking to someone comes in. And sleep problems, like snoring loudly, is not always harmless, right? We have some men who have thicker necks and, their body habitus may be bigger and they're dealing with sleep apnea. And one of the things that I want to talk about is that some people say, snoring is just a part of life. And that may be true. I snore a little bit when I'm tired. That's what I say. I'm not the one listening to it, but my husband may say something different. But sleep apnea, fatigue, falling asleep during the day, morning headaches, and poor concentration can tell us that there's something going on when it comes to sleep problems. And if it's left untreated, can be related to strokes, heart disease, and high blood pressure. And those put us at higher risk for other things. And so we have to make sure that we're taking care of that and not just saying, oh, well, it's just a normal part of life. We want to make sure that we're getting you in and get that sleep study done. Make sure we're getting in, doing the measurements and checking, your lungs and your heart and all the things to make sure you don't have undiagnosed sleep apnea and it's causing you some health problems down the line. Urinary and prostate symptoms. These are some of the things that men don't want to talk about. And often they ignore frequent urination, weak urine stream, waking up multiple times at night, noticing blood in the urine, or pain on urination are all warning signs that men need to really pay attention to. And just because it's common with aging doesn't mean that it should be ignored. I had a patient tell me, oh, I'm old and this prostate of mine is old as well. Well, that's not necessarily the case. So let's make sure that there's nothing else going on, no prostate cancer, no narrowing of the area, no inflammation or infection of the prostate that could be causing these issues. And if we rule out all of those other things, then we can chalk it up to being related to old or age. But before we move there, let's make sure that we're doing our due diligence and checking these things out and following the symptom to make sure that we are ruling out all the things that could be bad versus, a watch and see situation. What are some of the screenings that men need to get and when should they receive these screenings? And so some of the recommended screening typically should be from ages 18 to 39. It's recommended that they get their blood pressure checked every year, cholesterol every 4 to 6 years, diabetic screening if they're overweight or if there are risk factors, and then STI and HIV testing if the man is sexually active and or not using protection, mental health screenings, and testicular self-awareness. And so one of the things I want to back up, we talked about cholesterol. It says every 4 to 6 years. That I believe typically if you're going to see your healthcare provider, that you're getting that blood work done at least once a year, especially if your cholesterol levels are elevated. And some of these could just be the standard norm for a healthy individual with no comorbid conditions. However, if you're someone who does have some situations, some issues going on, high blood pressure, high cholesterol, diabetes, obesity, things of that nature, then your blood work might be ordered and done more frequently. So one of the things we want to talk about in terms of warning signs that you should never ignore. And I hear this so often, individuals who are having chest pain, but it feels like heartburn. So they're going to go get some medicine to deal with the heartburn. Let's rule out chest pain first and then verify that it's heartburn instead of ruling out heartburn and then we verify later that you have had a heart attack and it has damaged your heart. Severe headaches, depression, unexplained weight loss, like this individual is not doing anything out of the norm and they're losing weight rapidly or more frequently, more gradually than they typically would have. And then fatigue, that no matter how often you sleep, that fatigue is still there. With individuals who are between the ages of 40 and 49, recommended is annual physical exam, diabetic screening, cholesterol screenings, colon cancer discussion, starting at age 45 for those colon cancer discussions, and determine like which screening test is going to be best, which method is going to be best. Is there a family history of colon cancer? Do we need to screen this individual earlier? These are conversations that should be taking place at every yearly physical exam. And then the prostate discussion, especially in the Black family and the Black men. And if there's a family history, we want to make sure that we're screening these individuals. So 45 years old is recommended age to begin average risk colon cancer screening. It used to be older, but they found that they're younger individuals. And I believe now there's some research, and I'm not sure if there's any updated guidelines, but there's even younger individuals who are dealing with colorectal cancer. And when they're being diagnosed with colon cancer, it's at a much higher grade and stage of it. And so we want to make sure that we're really, even the young men are taking care of their health and they're getting screened accordingly. So what are the things that men notice, but they ignore? And this could be hormonally related, just like women, right? We deal with the whole weight gain and all. Listen, I digress, but let me keep my focus on the men. Weight gain around the stomach area. There's some individuals that I know had 6 packs, rock hard stomachs, and now all of a sudden they have bellies. And a lot of it is not because they're not working out. A lot of it is not because they're not eating right. It could be hormonal related, low sex drive, low libido, brain fog. They're really exhausted, don't have the stamina that they used to, and have elevated blood pressure. Oh, my blood pressure has been elevated. It's just a little bit. It's not too bad. We want to make sure that we are really focusing on that and watching those numbers, because if it's trending up a couple points every few years, every year it's going up and it's going up. In 5 years, where's your blood pressure going to be? And could we have not done something to manage it 3 years ago, so that now you're not on antihypertensive or high blood pressure medication? So at the age of 50, it's recommended again, and recommended at age, it used to be 50, but now it's 45, the colonoscopy, colorectal screening, PSA or prostate screening, again, having that conversation. And if you are someone who is a Black male and you have a family history or you have a family history, then we should be screening and having these conversations more frequently. Lung cancer screening, especially if there is a history of smoking. And typically during your physical exam, your annual exam, there's questions that's being asked you about your smoking history and your pack per year history. And it'll tell us whether or not you're at higher risk and if we should screen you with the CAT scan of the chest earlier rather than later. And then vision hearing screenings, and then heart disease risk assessment. So based on your age, based on your weight, based on your labs, where are you in terms of your risk factors for developing heart disease? And some of the symptoms that we need to make sure that men, that you are getting immediate help about, that it needs immediate attention, is blood in the stool, chest pressure or pain, shortness of breath, sudden weakness, especially if it's on one side of the body, and then difficulty speaking. These can all, the weakness and the difficulty speaking are all signs and symptoms of potential stroke. So we don't want to ignore those things. We want to make sure that you are getting help and getting help soon. So men, why do men avoid the doctor? I have a question. Why? Why? I had a patient that came to me, had not been to a healthcare provider in 22 years. And a friend of mine, our mutual friend, recommended that they come to see me. And so they did, and they were fine. No major health issues, blood work beautiful. And because of fear, this individual did not come or go see a healthcare provider in 22 years. So fear of the diagnosis, pride, quote unquote, I'm fine, I don't need that, financial concerns, generational conditioning, trauma from healthcare, and busy schedules. And this individual, when I spoke with him, the one who hadn't seen a healthcare provider in 22 years, when I spoke with him, what he said is that he did not trust the healthcare providers or the healthcare system. And he said it was refreshing to see someone that looked like me, that understood me, and who could talk the talk that I talk. And so it's important that you find a healthcare provider who can relate to you, right? And busy schedules. But let me tell you something, men. I was going to say, sir. Let me tell you something, sir. Your health will disrupt your schedule when something major is happening. So if you're busy, you're too busy to go and get health care, it's going to be a matter of time before something happens. And especially if you already have, comorbid conditions. And we want to make sure that we don't wait until something happens to be proactive about it, right? Men were taught how to survive, but never taught how to take care of themselves. And not a lot of men have that. They weren't taught. I just had a young individual who came to see me, and I had to sit and I talked to my husband about it. I was upstairs on my Peloton just working out, doing my exercise for the day, but it was pretty late in the evening. And I got this call at 10:15, and then I got a text message that said, hey, I was calling to see if you had an appointment tomorrow. And I'm like, first of all, who? And I was just confused, and I had questions. But then my husband and I talked about it, and maybe this individual wasn't taught that it's not professional to call a business when it's not an emergency. I digress. We have to do better with teaching our young men. We do. We definitely have to do better. So I want to end this section or this session with talking to the women, just a few minutes talking to the women. Sometimes the men we love will take care of everybody except for themselves. So we have to give them permission. We may have to urge them to go and get things taken care of. I can speak for my husband. He's good with some things when it comes to his health, but then there's some other things that I'm just looking at him like, you just got hurt and you didn't report that? Oh, I'll be fine. I'm good. Okay. All righty. So supporting them without shame, encouraging those annual visits. Listen, when you make your appointment, make their appointment as well. And I had a potential patient, and the friend was calling. That's what she called herself. The friend was calling to schedule the appointment. And I said to myself, why is this man not calling and scheduling his own appointment? And maybe it was because he just didn't want to, or he could not find it in himself to pick up the phone, and he just needed that support from her. And so instead of judging, I had to reframe it, right? To get a better understanding as to why. I'm looking forward to seeing this patient. Can't wait for them to come in. Paying attention to behavioral changes. We notice the changes in our partners or the ones that we are close to and live in the same house with, oftentimes before they do. And then talking openly about mental health. It's so important that we talk about how mental health is just as important as your physical health, and giving them a safe space to talk about some of the things and to discuss and navigate some of the things that they're dealing with and that they're going through. And it's so important that we do that. So, men, I want you to know that your pain matters, your mental health matters, how you feel matters, your body matters, your life matters. Strength is not suffering in silence. Getting checked is not weakness, right? I had a guy say to me, I'm not weak. I'm strong. I can deal with anything. Yeah, I agree with that you're strong and you can deal with anything. But to make sure that you continue in that strength, we need to make sure that your physical body, inside and out, is doing well. And this is someone who worked out, they bench press. I don't know how much he told me he can bench press and deadlift and all the things. And I was like, that's great. I can bench press such and such. So we kind of went back and forth. It was a little dialogue back and forth about what we can lift in the gym. And of course, I was nowhere near what he could lift in the gym, but just having that conversation with them. But talking about depression is not weakness. Taking medication that if you need it is not weakness. And for my patients that come to see me, they know I'm not the first one to prescribe a medication for you. Now, if you need it, we're going to go that route if you are agreeable, and I'll make those recommendations. And seeing a therapist is not weakness either. The strongest thing a man can do for himself is to stay alive for the people who love him and to stay alive for himself. And many times men, you are, and what I'm seeing, of course, I can't relate in that aspect. I can only relate from a clinical experience with my male patients. And I just want you to know, if you have not been to a healthcare provider this year, schedule your appointment. 321-306-6755. If you are ignoring symptoms, stop waiting. It could be something very minor, and you're stressing yourself, you're avoiding, and you're making a mountain out of molehill in your mind when it's really something very minor. If your body has been whispering to you, listen to it before it starts screaming. And once our bodies begin to scream at us, we've waited too long. We've waited too long. So I have a question for you, for the men who are watching. When was your last physical exam? When was your last physical exam? And what health issues do men avoid talking about the most? Like, let's talk. And then, when I talk to men and we discuss their health history and their family history, I look at the men, their fathers, their grandfathers. Did they go to the doctors? Did they get their annual checkups? Did their mothers have opportunity to get their checkups? And I saw a young man today who has not seen a doctor since he was like 8 years old. He's, I think, 15 years old now. And what's one thing you wish men took more seriously? For me, it would be their health. So, men, as we continue with this series, this is the first part of this month-long series on men's health. I want you to tap in. I want you to listen. I want you to reach out. I want you to know that we see you and we hear you and we support you. And if you're having trouble making that call, you can text 321-306-6755. Say, hey, Dr. Wells, I need to make an appointment. Can you give me a call? I will call you, or my assistant will call you, and we will get you scheduled for your appointment. We offer flexibility, so you can't say, oh, I got to work. You can come in as early as you need. We can see you as late within reason. We have some afternoon, evening, and weekend appointments available. So there is no excuse. I'm taking all the excuses off the table, right? So I just want to say thank you all so much for listening to this segment on men's health. Share this information. Invite a man that you know. And stay tuned to our social sites. We're going to be having some amazing information, just encouraging information for the men throughout the month of June. Stay safe and be well. This is Dr. Latoya Wells with Wells Legacy Health and Wellness. Until next time, we'll see you soon.